Imaging has really changed drastically over the last 15 years. And if you look at where we were, say maybe 20 years ago, if you went to your doctor's office, you could get a radiograph, an X-ray. Ultrasound was just in its infancy. CAT scans were just beginning. MRI was unheard of at that time. So much of your visit really relied on the physical examination and what you could tell your physician. And as imaging has increased and its capabilities have increased and the costs have come down, what that has allowed us to do is to look in very, very, very fine detail at all of the organs in your body and the things that can go wrong, and help to make that determination and diagnosis much earlier than could have been done 2 decades ago, or even 1 decade ago. It's really changed that much.
Medical imaging is important because it's a way to see inside the body and make diagnoses in a very quick and easy and painless way. And now the technology has developed to such a point that with the imaging equipment we have at DXP, advanced CAT scans, the latest MRI machines, ultrasound machines, we're able to diagnose conditions and problems that we weren't able to do even a few years ago. And that makes a big difference because you're able to find diseases earlier, you're able to find problems earlier, and then they're able to be treated earlier. In addition, there are things that we can see now that used to require a procedure or a surgery to find, whereas now we can see it with a procedure that may last 10 or 15 minutes.
The most important way imaging is used in treatment of disease basically has to do with my specialty, interventional radiology. And that's where we use imaging techniques such as ultrasound, CAT scan, fluoroscopy, which is live X-ray, to help us guide needles, catheters, devices within the body. It allows us to do this using very small incisions, which usually require no stitches, no sutures, very short recovery time, outpatient procedure, go home the same day.
We use imaging quite frequently to guide procedures that, again, maybe a few years ago could have only been done with open surgery.
So you can imagine if you were trying to find a tumor within the liver. If you were doing it in the operating room, of course, you would open the patient, you would put your hands on the liver, you would find the lesion. Sometimes you would use intraoperative ultrasound and do it that way. But if I wanted to biopsy that same lesion, for example, it'd be very easy for me to take the patient to CAT scan, localize it under CAT scan, take a very specific needle without an incision and go directly right through the skin, the muscle, into the liver, into the lesion, take my biopsy with no incision. And of course the patient is sedated and very comfortable. The recoup time is markedly different. So it gives you an idea about how we use imaging to steer things within the body.
We're able to use that medical imaging to actually guide us as we go inside the body through a very tiny hole and fix whatever problem it is that we need to fix. So medical imaging now, CAT scans, ultrasounds, X-ray, MRI, can actually guide us as we go inside the body and fix problems in a very minimally invasive way.
Those kind of imaging guided systems allow us to come within millimeters of something, where we can so precisely biopsy something or sample something or even take things out now could have never been done before.